In 2012, nearly 30 million people will experience symptoms of a heart attack severe enough to send them to the emergency room. While the majority of these people will ultimately not be diagnosed as having a heart attack, the million plus that are require rapid diagnosis and intervention to prevent death and reduce long-term cardiac damage. Nanomix has developed Omega3, a point-of-care diagnostic platform which utilizes a cardiac test panel to accelerate the diagnosis of myocardial infarction. Designed to provide the earliest testing of cardiac biomarkers, Omega3 will provide quantitative measurement of 3 critical cardiac markers: troponin, myoglobin, and fatty acid-binding protein, as well as a measure of creatinine. Omega3 uses a patented electronic biosensor to produce quantitative results with sensitivity and precision equivalent to the laboratory-based systems. The platform consists of a self-contained assay cartridge and a battery-powered handheld reader, enabling testing at the patient's side in the emergency department, or even by paramedics or first responders in the field during their first contact with the patient. Omega3 is designed to be completely portable while maintaining the high levels of diagnostic performance required for a rapid and accurate diagnosis. Let's take a look. First, whole blood collected from a finger stick or venous blood collection device is transferred onto the cartridge prior to inserting into the reader. The reader automatically detects the cartridge and the operator starts the test with a simple push of a button. The blood sample enters the cartridge and is drawn through a plasma filter. The filtered sample is then pulled into the reporter chamber where it mixes with the lyophilized reporter pellet. The reporter pellet contains target-specific reporter conjugates that bind each cardiac marker. Next, the sample moves to the sensor chamber where the creatinine level is measured, and the Nanomix carbon nanotube sensors with cardiac marker-specific capture antibodies bind the target reporter complexes. The electrode chamber is then automatically washed several times to eliminate unbound material and reduce background noise. The substrate is now added. The electronic signal generated at each electrode is captured and a quantitative value for each assay is determined and reported on the reader display. These results are also collected and stored in memory for later use. All waste is contained in the cartridge for easy disposal after removal from the reader. The total process takes only 10 minutes. By making this test portable and bringing it to the patient, Omega3 will provide the critical results required for rapid diagnosis of myocardial infarction. Scientific data suggests that reducing the time to diagnosis by 30 to 60 minutes can reduce patient mortality by more than 1/3. Accelerating medical intervention will improve ER efficiencies and provide the best possible outcome for patients. Nanomix is rewriting the book on point-of-care testing. Using the latest developments in nanoelectronics and microfluidics, Nanomix is developing an easy-to-use point-of-care testing platform with the power of laboratory-based instruments and turnaround times measured in minutes rather than hours. Critical cardiac testing is only the first step. The platform will expand in the future to encompass many additional patient-critical diagnostic tests.